You can play again. Once you play, then we'll start. So good evening, friends. Me, Dr. Nirupama Agarwal, welcome you all on behalf of Homeopathic Journal India Foundation. We are going to continue all the activities which we were taking before on the platform of NJH, like seminars, webinars, CMEs, e-journals. Today, we have Dr. C.H. Asrani sir with us, who is MBBS DNB, and he has rich experience in clinical practice over 40 years. Last 20 years, he has experience in insurance consulting and he has taken over 500 seminars. He has been training across Dubai, Bangkok, Malaysia, Singapore, and he is a founder of Inches Economy, and he conducts workshops for practicing doctors and insurance professionals. So I invite you, sir, on our first webinar on this platform, as our tradition is to seek blessings from our teachers. So welcome, sir, and bless us in our journey of medical education.
Thank you, Dr. Nirupama. Today's speaker is stellar Dr. Praveen Kumar, and I was taken aback, pleasurably so, when he asked me to start the discussion on this amazing topic, having a unprejudiced observation of a patient. So I will not take too much time between you and Dr. Praveen Kumar, who actually needs no introduction. We are doctors. We are above intelligence as compared to common population. And by the time we enter our practice, we are around 25 years of age. In these 25 years, we have formed prejudices, we have formed biases without realizing it. What is a prejudice? A prejudice is our attitude, and it's a cognitive process. It's a process full of thoughts. We gather information, we process it, and we store it for future use. Commonest prejudices come to us from our family members and peers. Prejudice could be religious. In India, that is commonest. Based on socioeconomic strata, morality. I am a doctor. A patient comes to me and tells me that he is sleeping with the neighbor's wife. Do I have a right to judge him morally? No. My job is to treat him. And we doctors are not aware of these biases, these prejudices. And when we gather experience, our prejudices increase, our biases increase. We look at a patient, and before the patient has opened the mouth, we have a diagnosis in mind and we have a remedy in mind. And that causes a lot of harm to the patient, that causes you not to get results. So, many times in your career, you must have started, oh, I'm not getting the desired result. Let me rethink the case. You are starting on a clean slate. Every case that you take should be started on a clean slate, absolutely no prejudices. You have to listen to the patient, process that information, arrive at a conclusion, and treat. He may be a beggar. He may be somebody coming in a Mercedes car. We are not here to judge people. And a prejudice is judging before you know anything about the person. So, Dr. Praveen Kumar, over to you to give your gems of wisdom on how we should be an unprejudiced observer. Over to Dr. Praveen Kumar.
Thank you very much, sir. Thanks a lot. For two reasons, I requested you, sir. First, this is a new chapter. Though old wine in new bottle.
Sir, your
yet-
camera is off.
Sir, please start your video.
Video, yes, sir.
It is there, no? Am I not?
No, sir.
No, you're not visible. I think everybody else should put off the video so he can be visible here.
No. Am I visible?
Not yet.
Visible, somebody wrote.
Yeah,
Visible.
Dr. Yeah, Praveen sir is
Praveen,
visible,
yes.
but I think his name
Dr.
is.
Praveen, you are visible, but your screen is not visible.
Oh,
You are visible.
Sir,
but
he has
the
not
screen.
yet shared the
my
screen.
screen, it should be shared by Dr. Nirupama.
Preeti. Preeti will share that.
So, shall I continue? Yeah.
Please, I think.
So, Dr. Asrani ji, I wanted your wisdom to speak on this auspicious day, or mainly two things. One, it is the new beginning of our IJH or HJI. Second, I really appreciate your comments, your talks on different topics, touching upon the salient and important aspects of each topic. So I'm so happy that you have started this unprejudiced observer topic. Thank you very much, sir. And I thank Dr. Nirupama as well for the introduction and starting this program. So, dear friends, without wasting much time, I would request Dr. Nirupama to start the sharing of screen, sharing of the.
Yes. Preeti, if you can share sir's PPTs.
As Dr. Asrani was mentioning, we should have open-mindedness to become unprejudiced. We can't judge a person. Like the old one, everybody would be aware, one foreigner was going in front of a crematorium and a Hindu lady was fanning the graveyard. The grave, rather. And that foreigner stopped there and he asked, so great India, you're fanning, whose grave is this? She said, it is my husband's. So great, dedicated to your husband, fantastic. She said, no, not like that. In fact, my husband took a promise from me that I should not get married till this grave dries up. So I am drying it up. This is what, like, we jump to conclusion by looking at some person. And most of the times in our clinical practice as well, when a patient comes to us, if there is a problem, we say, how did it start? When did it start? And if somebody were to tell that there is a history of somebody dying in the family who was very close to this patient, we would attribute it to grief. In fact, in our NJH SSMS, 3 or 4 years back, I believe, I have presented one case without presentation. Rather, I just shared that case when we were in workshop with Dr. Anil Bhatia sir during my PG, one gentleman came to the clinic. I took the whole case. And this man is from Kutch in Gujarat. His father died at his 5th year of his age. And he struggled hard. He, along with his younger brother and mother, they came to their mama's house in Bombay from Kutch, adjusted in a very small locality. And not this case, Dr. Nirupama. I'll tell how it went to change. I'm just telling this was my experience. So this man came to Bombay, struggled hard and established his business. So I have taken the whole case, the symptoms, everything, and I presented it to Dr. Anil Bhatia sir. I told him, sir, this is the grief. From there, the whole saga continued. So my drug of choice is Natrium muriaticum. Anil Bhatia sir asked one question, where is grief? I said, sir, it started at 5th year of his age and he lost his father. Dr. Anil Bhatia asked that patient 2-3 questions in Gujarati language. And then he asked, no, Praveen, you ask the patient. So I asked the patient in Hindi, I asked, आपको क्या लगता है आपके पिताजी याद आता है? हाँ आता है. तो जब भी याद आता है आपको क्या लगता है, कैसे लगता है? Then he said, सच बताऊं सर. I said, please tell me. साला मर गए बहुत अच्छा हुआ. Now, who is in grief? Whether he is in grief or I was in grief. I was in grief. Because all my edifice built on grief has fallen into pieces. What was the major mistake I made? I became prejudiced that if somebody's father dies, we will go into grief. But there are people who enjoy. So he was given Medorinum by Dr. Anil Bhatia. This is one such example wherein we can say, let us not jump to conclusion in our clinical practice. When we take the case, let it be finished. You don't attribute the feelings and emotions and all that. We become very sensitive. That should not happen. I'll share one case with you. Yes, madam.
Preeti?
This is a lady, 35-year-old, came to OP in my college with excessive sexual desire since 3 years. This was the case taken by the PGs, presented to me. She was sitting by the side. And mind well, in a government college OP, there would be PGs, interns, and my assistants would be sitting there. So I asked that lady in front of everybody, is it correct? The symptom, what they said. She said in Telugu, yes, it is correct. I was shocked. The sexual desire was more even during menses. This is something funny. She started abusing her husband and mother-in-law. And if you see the personal history, nothing significant. Next, please. So if you see the menstrual history, regular but scanty, too short, 1 to 2 days, 2 children, boys, full-term normal delivery, past history, frequent episodes of urinary tract infection, chickenpox during childhood, ambithermal temperature-wise, the thermal modality. Now, when we have taken this whole case, they have taken and presented it to me. Next, please.
Preeti?
So, PGs presented the case and suggested Platina is the drug of choice. And they were not wrong. There were quite a few symptoms which are akin to Platina drug picture and excessive sexual desire. So they were right from their angle on the face of it. So any doctor for that matter probably would get carried away when we become prejudiced, but spend a little time. When I have asked, she agreed that she was asking her husband for frequent sex. I asked in different format also. She agreed, yes, I am asking. The husband, in fact, brought the wife and told in Telugu, please save me from her. She is torturing me every day, morning, afternoon, evening, night. It is becoming hell for me. So I asked, is he right? Yes, it is right. Bold enough. Then Platina should be the drug of choice. But I sense something wrong. No lady would agree in front of so many men all these points what they were already narrated. What is wrong in her? She's not mad. She's speaking sensibly. So then I thought there is something like dal mein kuch kala hai ya pura dal kala hai. So let us find out. So next.
Preeti.
So I asked the husband to go out. He little resisted, but I told him, go out, sit outside. I'll tell you, I want to talk to your wife. So the husband went out. And then I sat with her, and then, though of course my PG students, assistants are there, but there, I asked her, please explain in detail, why are you doing like this? Then she came out. She was tortured by her husband and mother-in-law for 12 years, 12 long years, for even petty reasons. Husband used to beat her also. She was humiliated in front of every relative and every guest. She found it so difficult to move in the society, go to her family people, go to her relatives people. She selected, in her own words, she said, we can defeat a man in this field only. So this fellow has to run away. Now I will torture him. If I ask anything, he might beat me. But if I ask this, he cannot do enough. I decided, and I wanted to take revenge on him. So this is the one which is teaching lesson to him. And my mother-in-law is also scared of seeing me. I became little ruthless. I started abusing language, vulgar language. I know it is wrong, but I only know all these 12 years. How was I more than like 15 years back? She got married. So now what is the remedy? Can it be Platina? No, it cannot be Platina. So with our prejudiced mind, we thought excessive sexual desire is Platina. It can be acid floor, it can be natramor, it can be veratrum album, you name it. There are many drugs which have that. But should we jump to conclusion? What is the problem there? We became prejudiced. We were thinking only one drug, let us give this. No, we didn't give it. So we stopped for some time. Thanks to my PGs, because they always keep me on my toes so that I should be cautious. Had it been my clinic, probably without much time to spend, I probably would have been carried away. So, next please. Now you are all knowing it. Increased sexual desire, menses for short period, abusive, suppressed anger, ailments from humiliation. You don't require the whole lot of case study here. These 5 important characteristic features. Now you know the drug, right? Is it written, Dr. Nirupama? Anybody wrote in the chat box?
Not yet.
Okay.
Staffy. One has come. Staffy.
One answer came. Okay. Yes. Go. Next, madam. Absolutely right. Even if it is one answer, it was absolutely correct. Staffs agree at 10 m, later 50 m. But counseling to the husband was very important. That idiot has to understand what made her to behave like this. So that opened our eyes once again. Not that it was first time. Several hundred times it would have happened in our clinical practice. In so many long years of practice, we jump to conclusion and we want to give it. I'll give you one more small example. One patient came holding his right flank with severe pain, colicky pain, very anxious. And he came to the clinic rushing without his appointment, I think almost shouting, crying. He was telling, sir, please do something. If you cannot do anything, I will die here in half an hour time. So that is enough, the presentation. I'm not becoming prejudiced. Right side renal colic, sarsaparilla, berberis. No. But there is one characteristic feature which is telling that he has tremendous anxiety, fear of death, predicting the time of death. So the aconite was the drug of choice. What we do in our clinical practice, most of the time, we have done several times, not that we are teaching you good lessons. No, we are telling from our mistakes, our experience all these years. You should not make mistake. Mother tells the child, don't touch the fire, it will burn your fingers. So that's what we are trying to tell you. Don't burn your fingers. Being prejudiced. We have to be unprejudiced. Sixth aphorism, Hahnemann told very clearly. So we have to be cautious. Next. This was one example I wanted to give the class. You know very well, a person who watches or notices something is an observer. Many of us observe, but when it is a time for us to observe the characteristic feature in a patient, we miss it. I go back to my experience when Dr. Anil Bhatia clinic, we were having workshop. One lady came inside, sat in the chair, and she was having fidgety of fit, which we did not recognize, we did not look at it. She was narrating the symptoms, but Anil Bhatia sir was observing the patient from head to toe. But we were only looking at her, taking the case like a clerk does that. We were not observing. We have to observe every movement, everything. Dr. Vishpala, once we lost her, once she told she observed a patient in the waiting hall and selected a remedy, kept in the mind and put it on the paper. And when the patient came and told the whole case, that was the drug which was prescribed. So if you observe, you will get perfectly. So what happens? A prejudice is an opinion or a judgment that is not based on reason or actual experience. Before knowing the facts, we jump to conclusion. She is so, she is like this. Always we make mistakes. For example, all smart people could be pulsatilla or phosphorus. Need not be. A fat, stout lady can also be pulsatilla. They are also given in our textbook of Mathematics. So we can't jump to conclusion by seeing one characteristic feature. We have to find out. So who is an unprejudiced observer? One who is not having unreasonable opinions. We should not. I told in the very beginning that we should have open-mindedness. We should be able to perceive observe, understand, and then put it into our armamentarium. Understand that. Next, please. So this we all know. Sixth aphorism. One, the unprejudiced observer is well aware of the futility of transcendental speculation. He used a beautiful word, Hahnemann here. Transcendental speculations, vaguely, ambitiously, extravagant in speculation, imaginary. So these things we will have as an obstacle to proceed further. They will receive no confirmation from experience. If you are experienced, there is no confirmation. We have to be careful. In fact, the experience tells you that it could have different aspects for this particular expression. We need to understand that. Don't jump to conclusion. Next, please. So to continue, sixth aphorism. Be his powers of penetration ever so great, takes note of nothing in every individual disease except the changes in the health of the body and of the mind. What he says, in each individual disease, we have to see the deviations of mind and body. And they can be called as expression in the form of symptoms. That can be perceived externally by means of the senses. The patient expresses and we observe, we come to conclusion of that in a right way after taking the whole case. Next, please. So he notices only the deviations from the former healthy state of the now diseased individual. That is very essential. Hahnemann cautions us, all of us in aphorism 6, that we have to notice what is the deviation. For example, I have been the hottest patient. I couldn't bear the heat and all that. You can't take that as a symptom. That is my state. That is my nature. It might help you to understand my constitution, but that is not the symptom. Everybody is having his own constitution, his or her. So if we know the state, we know what are the deviations and we know what is to be treated in the individual. In third aphorism, Hahnemann mentions very clearly, we need to understand the knowledge of disease, knowledge of medicine, and knowledge of application of one to the other. So we can't just jump and take decision episodically. So all these perceptible signs represent the disease in its whole extent. That is, together they form the true and only conceivable portrait of the disease. This is very, very essential. Next.
Priti?
There is a lengthy footnote to sixth aphorism. What he says, like he talks, what are all the cognizable senses, how you have to display, how you have to take the note of symptoms, the signs, the expressions, all these things he cautions. I wish you all have read once or so many times, but I request you all to read it at least tonight once, so that you will be fresh in your memory about this sixth aphorism and its footnote. It guides you to be cautious, careful, and what is to be noted, what procedure you have to adopt, and how you can take up the radical or rational treatment, which treatment is adopted. All these precautions he has given in this footnote of sixth aphorism. Next, please. I'm not going into all those details. Next, please.
Priti?
So, what he said, like what a disease. No, earlier. What a disease actually is, what is perceptible and experienced. This is very important from homeopathic standpoint. I'm not trying to speak to you about the theory of prejudiced or unprejudiced observer, but I am trying to caution you, tell you that we make blunders in our practice and then curse ourselves. Why did I make this mistake? And some of the patients we would have lost because we made a mistake. All of the patients won't be stuck to you. So, in the first part of this aphorism, Hahnemann warns against transcendental speculations, which cannot be confirmed from experience. He said transcendental speculation. Don't speculate. Don't predict. Next, please. Then in the footnote, what he said, like, he has always looked for the primary cause hidden somewhere in the interior of the body. That is more important. The primary cause is very important. He said that has its own significance. There is some primary cause. But what is the underlying cause? What is the most? It is a complex system. The whole human body is complex system. And this complex system is engaged in combating the disease, which is trying to take away, which has caused the deviation of vital force. So now we need to have this whole spectrum of symptoms, which you call it as totality of perceptible symptoms. This you call it as disease. So all these perceived symptoms in the human being, you can call them as the disease. Next, please. In the whole lot of sixth aphorism itself, he explained many points. It looks a small aphorism talking about unprejudiced observer, but he spoke about our speculations. He spoke about what is to be understood as disease, what is the expression of these perceptible symptoms. All these things are discussed at length by Hahnemann in just one sixth aphorism. Next, please. Other than being a leading physician, Hahnemann was a researcher. We all know very well he was a great researcher. He never accepted any fact. We know very well who is a scientist. One who is curious about obvious. So, had he not questioned Cullen's Mathematica, we wouldn't have got homeopathy. So he had been questioning, even if obvious or not obvious, he questioned everything, experimented, researched on that, and then got the answer for it. Then only he put it into Organon and other important books. So he was working through methodological experimentation, scientific experimentation. He never left to just win and just speculations or concepts. So he put it on a very rational footing. We all agree, we all know, because of which we have got such a tremendous therapeutic system, which is giving us fruits, which is giving us everything, name, fame, everything today. Next, please. If you see, many people have been talking about disease gestalt. David Hubenstein is from Victoria, Austria. He said, a gestalt is something that is an organized whole that is perceived as more than the sum of its parts. This is similar to Hahnemann's expression. Not that somebody else spoke, Hahnemann was equated, no. But there were many other people in the contemporary science who were also speaking similar to Hahnemann's view. Next, please. Then Hahnemann, he describes the gestalt is consisting of the changes in the health of the body and of the mind. Many a time, in many systems of therapeutic field, mind is ignored. Not that we are mental, they are not mental, but mental aspect is ignored to a greater extent. But this can be perceived by means of the senses, felt by the patient himself, remarked by those around him, observed by the physician. Now we need three factors. The patient, what he felt, and the attendants, what they really remarked, observed them, and what it has been observed by the physician. If the patient is telling something and the attendants are something different, our observation will confirm which is correct, which is the exact expression of this disease. Next, please. So these are all subjective experience of the patient and objective observations by the physician, family, friends, and all that. So all these perceptible signs represent the disease in its whole extent. That is, together they form the true and only conceivable portrait of the disease. Why are we discussing about portrait of disease? Because we miss the bus if we don't make a portrait of the disease of an individual, understand his feelings, observations by others, and our own observations put together. If we have something correctly, then we can match with the remedy which we have in our armamentarium and prescribe so that the patient will be alleviated from his suffering, and we can definitely aim at giving him temporary or complete or permanent cure. Depends on the class of the case according to Hahnemannian clinical classification of diseases. Next, please. So we require scientific knowledge that would be acquired through minute observation and experimentation. So observation is nothing but perception with a definite purpose. What we have done earlier in the mistaken identity of platina in the case, our observation was wrong initially. We have jumped to conclusion. So we have to have a perception with a definite purpose. We should unravel everything, right? Next, please. So we have to see everything. Ideal observation fails when it is either non-observation or mal-observation. This is the ground for our prejudiced observation or our failure in the case, given case. Non-observation, we have ignored what the patient is telling, or mal-observation. Many a time I have seen doctor would be writing like a clerk. He would be putting his head down and writing down as the patient is narrating. But in the narration, patient's expression is missed by the doctor. We should be careful in catching every point. As my teacher used to say, the most important characteristic feature of the patient is told as a passing remark. Nobody would tell you this is very characteristic feature, please underline, I'm telling you now. Nobody would tell that. So we should be able to observe it. So the non-observation or mal-observation are very dangerous, and our observation fails in this category. Next, please. So what is non-observation? We know very well. When we have some purpose. When we don't have a purpose, we have, like, now suppose we have a free convinced favorite theory. We have a theory. And most of you are aware that is even till today, there is a society in London which says Rectangular Earth Society. Even when the satellites are taking pictures, everybody knows Earth is in global shape, round. But yet there is a theory. So that theory, they believe in it. They are prejudiced. Whatever you try to convince them, you can't. It is like the brain is with the iron shackle. It can't be removed from it. So we observe those facts, we support that theory, or sometimes the physician does not even try to observe because of his unconscious bias. We are biased. We should never be biased. Next, please. Then what is mal-observation? This non-observation again, negative fallacy. Next, please. Mal-observation is positive fallacy. That is also fallacy. This is also fallacy. There it is completely zero, no observation. Here it is plus, but it is defective observation. So the facts are twisted. A false picture comes out, and that we claim that that is the observation. I give you one example. We were having posting in a hospital in Bombay. I don't name the hospital. Under one senior doctor. The senior doctor asked a question. She was asking all the questions and the patient was not giving any great details. And she wanted to impress upon us. So she asked the gentleman, now please tell me, if you are given vacation, where will you go? Till that time, okay. but she suggested, is it hill station or a valley? Then mind well, you are in Bombay and who will go to a valley? He said hill station. You can write wants to go to hill station. To that extent also, okay, we can accept. But she wrote in her case sheet, adventurous. I asked the question, where is adventurousness in this man? He being in Bombay, he wants to go to hill station. So what is wrong in it? She says, no, going to a hill is adventurous. That is your prejudiced positive fallacy, mal observation. So we make mistakes, and this mistake leads us to select a wrong drug. And everything is wrong. We are on a wrong track. Come back to the earlier part, review the case, then observe clearly, then give the medicine. Heavens are not going to fall. You have made a mistake, doesn't matter. Everybody did mistake. Hahnemann also did a lot of mistake. Hence we got 6th edition. Otherwise, you would have stuck to only 1st edition. So we should be clear in our mind, open-minded, to learn, to correct ourselves, and make our future very happy. Next, please. So the unprejudiced observer must be free from all bias, preconceived theories, unwanted assumptions, and must be ready to accept the fact and truth as it is seen in the patient, even though it may be opposite to the fact which is popularly known. This is something very important. I had one patient, HIV patient. She came to me and husband brought me. In fact, she is positive, husband is negative. And she came back. After 6 months, we treated 3 months, 3 months, we give the medicine. After 6 months, she came back and showed me the reports. Viral load became below detectable limits. CD4 was about 650. So I was also happy. I said, okay, let me have 3 more consecutive reports. Then we will go for Western blot, whether seroconversion has occurred or not. This is fine. Then she spoke to me after 3 months, collected medicine through courier. And 6 months later, she came back to me. And she said, I am pregnant. My God, I thought, so husband to gaya. Then I told, have you checked his blood? So what is that? I am prejudiced that husband will be positive because she became pregnant. But she said, he is not responsible. My boyfriend is responsible. So that is the fact. I should not have a bias, preconceived theories. Okay, husband could be somebody else also. This looks a little joke type, but this has made me think. I ask who was responsible, especially in HIV cases. Not everybody, they will beat me. So this is what we have to be unprejudiced without any assumptions. Next, please. So, besides treating judicially, the physician is required to study the totality of perceptible signs and symptoms, comprising the altered sensation and functions that can be obtained from the patient and the physician's observation, which plays an important role so that the chances of an error are abolished. There should not be error. Why are we talking about unprejudiced observer? So that we will not have an error in our prescription. So that we will be on a right path to succeed in the case. Next, please. So, to sum up, unprejudiced observer understands the uselessness of the theoretical guesswork and regards only the signs and symptoms of the patient. You don't jump to conclusion. Adventurous. Don't put your brain into it. Take it as likes to go to hill station. Take it even if it is from Bombay. Doesn't matter. Take it, at least it might carry some weight. But don't put adventurous. That is the more important aspect. Next, please. So homeopathy and phenomenology are pretty similar anyway. Why? What does it mean for us? Untainted. He should be untainted. There should not be any taint, any mark on his, like blur on him. He is doing his best to avoid received opinion. If somebody he gives his opinion. That is what, like in one class, if I remember well, Dr. Asrani told very clearly, don't see the reports the patient brings to you at the very outset, because it is already received opinion, somebody's opinion. Don't just carried away by that opinion. You take the whole case. He's speaking from his angle of making diagnosis and then selecting the tests which have to be done. It applies to our practice as well. Don't jump to conclusion of prescriptions given by other doctors. That would be useful when you have made up your mind some A drug is to be given, whether that was given by earlier doctor, in which potency, are you still sure of this same drug? How should it be given? That would help later. Okay, next please. So the subjectivity is to be diminished, and we should become very astute observer, very keen observer as a homeopath, as a physician for that matter, anybody. Next please. Observation means notice, watch carefully, make a remnant and obey law of rule. And medical practitioner is the best observer. Next please. Duty of the observer. The capability of observing accurately is not innate faculty, it is acquired by practice. Should not tell my father did not observe, so I also don't observe. Don't ever say that. You have to inculcate that habit of observing the patients carefully. And we need great patience and power also. Right. Next, please. We should be true and pure also. So, need for accurate observation is very essential, because many patients do come with lots of symptoms. We should understand. Like in one case, Dr. Tanveer Hussain of IAHP was presenting, where the patient told, I have pain in my kidneys. And in fact, the pain was in testicles. So we have to be careful, accurate observation, questioning properly, examination. All these things are essential for us to come to a right decision, right conclusion. Next, please. So this is very important. We need to have accurate observation. We cannot distinguish the peculiarity of morbid states, nor selecting the semilimum, if we cannot observe very accurately, perfectly. This is very important need for any physician. Next, please. So these are all different advantages. We know better how we can be the best observer rather than the observer. Like the attendants can also be observers. They observe what is happening to the patient. They come and explain. But it is for us to confirm whether we have done correctly or not. So we can do it very well. Next, please. And Kent also writes very beautifully, unprejudiced observer is the one who notes only change of state as shown by symptoms, which Hahnemann mentioned very clearly. Next, please. Deviation from normalcy is important. What should we do? Paragraph 85 tells very clearly, we have to be very particularly those things which the patient may conceal or cannot relate or does not know. Now she concealed that first case, what we have done. She concealed, she was projecting something different. But when you ask the husband to go out and ask, then they will tell. In one case, I tell you before I conclude, we are running short of time. In one case, one lady came with the diagnosis of IgA nephropathy. Her serum creatinine was shooting up to 4.5. All the symptoms. And whenever I was asking any question, her mother-in-law, who brought the patient, was answering. So I sensed dal mein kuch kala hai. So I told her she should stay back. I have to examine, and the mother-in-law should go out and sit. Then she cried, explained same thing like this Staphylococcus. And same Staphylococcus helped her, and IgA nephropathy became completely all right. She was blessed with a girl as well later. So this, and of course, counseling of the husband was very important. I told him to shift to Kakinada, where their branch office is there. Head office is in Hyderabad. I told him nothing happened. Operate from there. So she became all right. So this is what, like, we need to understand. The patients might conceal due to various reasons, and we have to unearth that. We have to reveal. Next. Okay, tissue changes do not indicate the remedy. We need to, that is very understandable. Next, please. Next, please. Physical examination, we should be careful about it. So the conclusion, who is a true observer? One who is aware of the uselessness of speculations, and one who takes note only of the signs and symptoms of the patient, because the physician cannot see the vital force which produces the disease. Obviously, I can touch the wire and get the current shock, but I can't see the current. Okay, if I have to see, I have to touch some bigger wire, then I can see and die. Okay, next. Thank you very much. I thank all my friends, all my
There is one
IGH
question.
teammates, Dr. Nirupama, Dr. Asrani particularly, and everybody. And most welcome to IGH. We will continue this saga uninterrupted like NGH, which it has done. Only the name is changed, everything is similar. Thank you very much. Good night.
Sir, there is one question. Can we
Yeah.
take shameless rubric in this case? Shameless.
Huh?
In Staphylococcus case, can we take rubric shameless?
Shameless.
Hmm.
Actually, shameless you can take as the expression, but why she became shameless? That is more important. Why she became shameless? All are not like Hyoscyamus or Stramonium or sulfur. They become shameless. No. There is a reason behind it. We have to see the reason behind it and then take that. That is more important. Next, please.
There is only
Any
one
question?
question. No, only one question.
Nirupama, Dr. Nirupama, you can take up if it is written there.
Only one question was there. There is no more questions. So
Thank you.
sir, for such a wonderful session. And who else can take such a wonderful session? Only a great teacher. And sir has got various great teacher awards. I will read few. He has got first best teacher award in 2017 from Telangana government. He has got Dr. B.K. Bose Memorial National Best Teacher Award in 2005. He has got Dr. Mahendra Singh Memorial National Best Award in 2014, and he is PG guide and researcher to various universities. Currently, he is researcher of homeopathy medicine through in vitro studies for HIV/AIDS in collaboration with Indian Institute of Clinical Research, Chemical Technology, Hyderabad. So basically, a teacher, professor, and researcher that can only take such a beautiful session along with the aphorisms. So thank you, sir, for a
Thank
wonderful
you. I
session.
should say thank you very much. Usually it is not customary to read the biodata after the completion. So
Yes,
you
sir,
complete
but
it.
it's my
Okay,
mistake.
okay.
Actually, I
No,
had
no
planned
need,
that
no need,
day.
madam, no need.
I'm
We
very
are all
sorry.
from one platform, IJH, right?
Yes, sir. Thank you, sir.
Thank you. Good night.
Good night.
Good night.